Can you talk about intermittent fasting? I've read many articles and listened to another doctor who recommends it to his kidney patients. Are there benefits to pre-diabetics and or weight loss? Also, I heard you mention Ozempic at the end of the last podcast. That would have been a few ago now. I was interested in this drug, but after doing some research, it looks like it makes many people sick. I'm not sure if it would be worth it. I need to lose about 30 pounds. Can you talk about the various diets, keto, etc.? I'm trying sensible eating, but not making much progress. Thanks. Keep up the good work. Making your dad proud. Well, thanks, Cheryl. That's fantastic. All right, Dante, we'll break this up. There's two big questions here. Starting with the first one. Can you talk about intermittent fasting? Is it good for kidney patients, people who are pre-diabetic and or weight loss?
Yeah, good questions. So I think a key point to start, much like keto, carnivore, if it fits your macros, which was popular back in the day, and similar with, intermittent fasting, you'll see strong opposition to anyone who, puts forth some sort of argument or tries to downplay.
Yeah, if you make a stand, you're going to have somebody fighting you.
Definitely. So intermittent fasting is, like many of the things we've talked about is a bit contentious. It's kind of crazy. Just a dietary intervention could be so controversial, but I digress. My input here, I wanted to try to be as thoughtful as possible, not trying to shoot this down in any way, but just present something that's, I think, fairly balanced. So here's the reality. There are a wide range of meal frequencies that can be effective in helping somebody meet their health or dietary goals.
So what you're saying is there's nothing magical about intermittent fasting specifically?
Yeah, unfortunately not. So it's really just it can be a very powerful tool to have, in the arsenal. So to get a little more granular here, I kind of broke this down into 3 questions. So what is intermittent fasting? Why are people doing this and why do they care about it? And then does it actually work? And so in Cheryl's case specifically, is this something that's going to work for pre-diabetes or diabetics or weight loss? So basically, intermittent fasting, what it is essentially is alternating between voluntary fasting and non-fasting periods. So the most common ratio that we'll see is a 16 to 8 hour ratio. So 16 hours without consuming any sort of food or food products with significant caloric value, and then an 8 hour window where essentially you can eat whatever you want.
Right.
So that's the most common form that we'll see. Variants of IF, and I'll refer to intermittent fasting as IF at this point, but two of the most common variants would be time restricted feeding, which essentially shortens the window of feeding to that roughly 6 to 8 hour per day window, and then whole day fasting, which is pretty self-explanatory.
So when you're saying 6 to 8 hour window, what you're talking about is like somebody who says, okay, I'm not going to eat anything until noon, and then I'm going to be finished with my dinner by 6 p.m. or 7 p.m. And that's it. So after whatever time, 7 p.m., I don't take another bite of food until noon the next day.
Exactly.
Okay.
And so really in that window of not eating, the only acceptable food, the only acceptable products are really like anything that doesn't have calories. So water, diet drinks, maybe like coffee, potentially that sort of stuff. That's about it. One other thing I wanted to mention here as well, it's not technically intermittent fasting, but intermittent energy restriction. We often see interchangeably used with IF as they obviously sound very much alike. But basically, and the reason I mention this is because it's like there's so many variants of this that can be tailored to somebody's needs. Yeah. And so that's why I'm not really quick to like shoot down intermittent fasting, because first of all, it's like, what form of intermittent fasting are we even talking about? Is it the 5 to 2? Is it this intermittent energy restriction where you take,
5 to 2 means eat for 5 days and then take 2 days off where you don't eat. Mm-hmm. Yeah. There are so many, a ton of variations of voluntarily fasting is the idea. Mm-hmm.
Exactly. And so then this other aspect, intermittent energy restriction, which can be a very appealing option to someone trying to lose weight. You basically have on weeks and off weeks.
Okay.
And so you're not eating for weeks at a time, but you essentially have an on week where you're eating at maintenance. And then you have another week where you're eating at slightly below maintenance each day. And then, or you could do 2 weeks on and you're eating at about maintenance. And then you have 2 weeks where you're, substantially below maintenance or a little bit below maintenance. There's so many ways to average out that caloric intake that can be very well suited to somebody's work schedule or preferences, or maybe they have vacations coming up and they know that maybe that's going to be a week or two of, indulgence of a little like irregular indulgence, let's just say. Yeah. So, to kind of recenter here, why are people doing this? So firstly, fasting as a whole obviously is not new. It's been practiced for centuries by various cultures and religions. And you guys could back me up on that.
Oh yeah.
Now the rise in its popularity as a health practice specifically has really shot up over the last decade. And I think this is due to the notion that IF might confer unique benefits with respect to meaningful clinical outcomes when you compare it to a traditional dietary pattern or caloric restriction. So it's just that there's like this nebulous benefit of doing this that separates it from any other sort of dietary intervention. It's like similar to some of these other fads that have like this, this really powerful thing that's getting people to take part. But logically, I think intermittent fasting makes sense. The thought is that our bodies, when without food or nutrients for an extended period of time, we can more efficiently tap into our body's energy stores. And so something like this will aid in weight loss or, help somebody maintaining a healthy weight. It's just the idea that giving the body time in a fasted state between meals makes sense. It's generally advisable. Yeah. And that's because there are physiological processes that maybe we won't get into today that take place in those fasting windows. And so whether you're fasting technically like 3 to 5 hours or 6 hours or whatever it is between meals, or if you take it to the other end of the extreme, 16 hours or so, there are things happening under the hood that are valuable. And so this wasn't like pulled out of nowhere. It has historical meaning, it has religious meaning, and it certainly has a basis in, whether you just want to call it like mechanistic data or, what am I looking for? Like mechanistic, practicality.
Sure.
It has the basis.
It works
scientifically in addition to just like this cultural influence. So, and the final thing that I'll let you jump in. The final thing that I'll mention there in that regard is that, and I guess this is kind of an aside. I'm under the impression that snacking, so if we refer to snacking as whatever you're eating in between meals, this is just a good practical example of why that's not really advisable. You want to leave distinct windows, or you want to leave distinct periods throughout the day for eating. And when you start to snack between your 4 and 6 hour meals, then when can you ever enter that, that fed state or that fasting state where we know that there are important processes that occur? It allows your insulin to sort of normalize. It helps maintain insulin sensitivity. So, all of the stuff that I'm mentioning now, those are all proponents towards, why fasting, whether it's 6 hours or 16 hours, has a potential for benefit.
Okay. Makes sense. So does it work for things like prediabetes and weight loss? Yeah.
So the short answer is yes, it absolutely can. Now the bigger question there is, does it actually work better or carry distinct benefits when compared to these other methods?
I guess that's a better question.
Yeah. And so the short answer there is, the benefits are trivial, really. So again, it's certainly a useful tool for the right person, but there's nothing inherently beneficial per se about it compared to somebody who's able to just restrict their calories, let's say. And I have some more stuff to
go ahead
unpack there.
Go for it.
But ultimately, the and not to be too reductionist, but the thing with intermittent fasting is that for most people, it'll result in a spontaneous reduction of caloric intake. And that's huge. That's the crux of it. And so when I say spontaneous reduction of caloric intake, that basically just means someone's not necessarily trying to eat less. It's they're following their windows of eating and not eating.
Yeah.
And because of the way that that's structured, they don't even have to think about consuming a caloric deficit. And so that can really help somebody prevent having to micromanage their caloric intake, because if you're not eating 16 hours of the day,
right,
it's going to be pretty challenging to eat 4,000 calories in 6 hours.
Right.
I mean, so, even if you're the hungriest person on earth, it'll be tough, especially initially.
If you're averaging, say, 800 calories a meal, that's 2,400 calories a day. And if you just cut one of those meals out, even if you up the caloric intake on the other two meals to 1,000 calories, you're still at a deficit from what you were before.
Definitely.
That's what you're saying, right?
Yes.
Okay.
Yes. And so this is the crux of why I think this can be a very useful tool. Somebody who's I refuse to count calories. I may have prediabetes. I may have a little bit of an issue with glycemic control. And hey, maybe this is something you talk to your doctor about. I think that's valid. But again, I want to drive this point home. It's this reduction of caloric intake that really carries the weight in terms of the benefit. And that's basically what we see across all of the IF research and all the dietary research that's compared. What matters more is actually achieving the caloric deficit or the appropriate caloric intake versus how you actually got there. So whether maybe you did some sort of keto hybrid or carnivore hybrid, and it got you to a caloric level where you could regulate your body weight, you can regulate your glycemic control, you can, you were eating a little bit less saturated fat, and it started to improve these markers of, or your blood lipid markers and such. And so it really came down to the overall caloric intake. There was a meta-analysis done by Headland and colleagues that looked at trials lasting longer than 6 months, which is a pretty significant amount of time. And it revealed that IF did not alter blood lipids, glucose, and insulin to a greater degree than standard daily caloric restriction. And so that's a very broad stroke of what that meta-analysis looked like. And then there was another trial by the same author that revealed that there was no significant weight loss when comparing these different styles of equated caloric restriction. So if there was a diet that got you to the same caloric levels as what you achieved with intermittent fasting, you saw the same outcomes with respect to glycemic control, blood lipids, weight loss, cardiovascular risk factors. So when all things are equated, it's hard to find what that silver bullet of intermittent fasting was really, set out to achieve.
Okay, so let me see if I can sum up what you just that you just said, because she's asking, what is it? Is it useful? Does it work? And the answer is, it's voluntarily not eating for a period of time. Totally up to you what that looks like. And does it work? Yes, sort of. It's not a magic pill. There's nothing unique about it beyond that it makes it easier to eat fewer calories in a given period of time.
Right.
And that what actually works in all of these situations is caloric reduction. That by eating fewer calories than you burn, you lose weight over time.
Yeah.
Your glycemic control increases, your response to sugar and all that improves, your lipids go down or up, depending on which one we're talking about. That ultimately, if you want to weigh less, you have to eat fewer calories. And what that looks like for you just depends on what works for you. If intermittent fasting works for you and is an easy way to do that, knock it out. If you can voluntarily restrict to a smaller caloric portion per meal, do that. But the bottom line is, it's just a tool. It's not anything unique, magical, or wonderful that you might have heard.
Yeah, absolutely. I mean, that very well said. And to, sum that up even further, it is generally safe for most people. So if that's something that she wanted to try, I think it's well within reason for her. Now, she did mention pre-diabetes. there is a chance because of these drastic reductions and increases in, the amounts of food that you're consuming, that the potential for hypoglycemia and hyperglycemia for somebody with prediabetes, that, is something to watch out for. So that's sort of why I kind of hedge my bet with saying, at least talk to your doctor about it as well. Again, especially if you're in the, in the pre-diabetes range, or if you do have diabetes.
So if she's in that pre-diabetes range, you're not going to, once you start eating, all of a sudden just pound the sugar and spike that blood sugar, and then you go back to fasting and it's dropping down like a rock. You want to exercise some reasonable caution here.
Definitely. And I know there's somebody out there saying too, like, well, I heard that intermittent fasting can lower my body's inflammation.
Yeah.
That's the main reason I'm doing it, is because of the systemic inflammation. Honestly, I would have to look a little further into that, but my broad search of the sort of the literature there, it's true, but it's also is something that's a little overstated as well. Like systemic body inflammation and the measures that we look at in those situations, a lot of that is so complicated.
Yeah.
And we're trying to look at things more broadly than just like these little transient minute to minute changes in inflammation and those sorts of things. So yes, it can definitely help with inflammation. However, you're specifically defining that will depend. It can help, but similar to the other outcomes that we talked about, I think a tempered expectation is useful there.
Fair enough.
So
let's hit the second part of this real quick. She got an in-depth answer on that. Tell me about Ozempic. I know we've talked about it before. She was interested and then saw that a bunch of people feel very sick when they take it. She's got 30 pounds to lose. What is the suggestion for her? Should she be on Ozempic? I know you can't specifically say, yes, you should take a drug. That's not the way that this can be handled, but.
Yeah. Just hearing about somebody's side effects or, some sort of anecdote, positive or negative, it's like you have to kind of take with a grain of salt.
Right.
I think maybe given, her health metrics and, where she sits on that spectrum, it sounds as though it could be a good option. There's more than Ozempic now. There's the Wegovy, the technical, weight loss approved version of semaglutide that has a little more flexibility in dosing.
Yep.
So it might be useful from a side effect perspective that they titrate her up slowly using those different dosing. So that's one way to mitigate some of that. But as with all medications, it's or new initiations of treatment, there's always a non-zero risk, and you take calculated risks with this, but the fear of side effects, I think in this case, I don't know how much good that's going to do for her, because if she were to start and she felt like crap and just couldn't quite shake that, you can always kind of switch gears.
Yeah.
I do think it's something that she should at least talk to her doctor about.
Okay.
You know what? The one part I didn't want to gloss over was that, how much that intermittent fasting could help with caloric reduction. Like that's kind of the crux of all this. It's so difficult given the landscape and the society that we live in. It's hard for anybody to just spontaneously reduce their caloric intake, again, due to a multitude of factors. So whether it's intermittent fasting or something like Ozempic that can help somebody basically spontaneously reduce intake, I mean, like that's no small feat.
Right.
So those are two key links here between both of her questions, is how effective both of those things can be with reducing intake. And in her case, that's, ultimately what the goal would be.
So again, there's not, because she asked about various diets, keto, et cetera.
Yeah.
Same answer. There's not a magic bullet. The point is you've got to eat less than you burn. And if that's through intermittent fasting or using a restrictive diet or taking a medication like Ozempic or Wegovy that allows you to feel full and not want to eat, whatever the case may be, there's really only one way to reduce body weight other than surgical interventions, but
Sure.
we're not talking about that.
Right. Which is an option, but not, I think that there are things before that you could potentially do. And you did mention one of the specific side effects that not just the nausea, vomiting, like those sorts of like very unpleasant things. The one side effect that's getting a lot of attention, at least in my bubble, is the decrease in muscle mass that apparently is occurring, that the extreme loss in lean muscle mass that might be occurring in patients that might be deterring people from using it.
Yeah.
It's strongly recommended to continue resistance training and still, consuming adequate protein and all that sort of stuff. So it's certainly possible to lose weight, sustain the weight loss on these medications, and maintain and then begin to build lean muscle mass as you progress on this. This isn't like a 2-week thing. It's going to be a process.
If somebody's hearing about that, I saw that same thing. Yeah. If somebody's hearing about lean muscle mass loss, the answer is, that can happen. So keep exercising.
And it's still, you definitely don't want to lose sight of what the goal is, and that's to, achieve the body weight goal and all of that as well.
Cool.
And glycemic control.